We got a call for a bariatric patient complaining of some foot pain.
Bariatric patients above 350 pounds.
We've seen people with rotting skin, infections.
I've taken patients upward of 700 pounds. And there's no way to safely transport somebody like that unless you're us.
The bariatrics developed because we started seeing a growth, no pun intended, in the people within the area. Upwards of 800 to 1,000 pounds, some of these patients. That's when we decided we're going to go out and develop special equipment just to handle those patients. We have a special stretcher that handles upwards of 1,600 pounds.
We also have a ramp and a winch that we can hook up to load them right in.
Before this winch system, we were getting like, there was 6 people here to lift this guy up.
Back injuries are very common.
We just got a call for a patient with foot pain, so we're going to set up the bariatric unit, ramps, winch, and we'll bring a stretcher upstairs, get some vitals on our patient, see if he's all right, and then transport him to the ER.
How you doing?
All right, Steve.
How you doing?
What's going on today?
My leg.
Your leg hurts again?
Yeah. It's from here down, the swelling's getting bad around this area.
It takes certain skills to do this job. Obviously some people skills. You're actually going to have some compassion for your patients, actually have a heart.
1, 2, 3.
It's good to help them. You know, they're obviously in need of assistance. I mean, it's tough for them getting around.
I started putting on weight around 20 years old. I was around well over 400 pounds at 20, so it's just my reality.
What's your diet?
My weakness, pizza. That's what I eat. The biggest struggle living alone is just eating whatever you want and not, having anybody there to tell you you can't have it. I'm what they call a frequent flyer.
We in? Meet you on the other side, Steve.
Yeah, all set, thank you.
There we are.
I'm trying to accomplish my goal of losing weight and becoming a normal size, like maybe, even 300 pounds would be good, just having a normal life again.
Right now we're headed off to take care of a lady. They said she's pretty big and that we're gonna have our hands full. At a bare minimum, you'll find that they have some type of decubitus ulcer in between the rolls on their stomach or on their arms. They have different funguses and bacterial infections, which generally can be kind of smelly. Hey there.
Hi.
How you doing, Angela?
Oh, hi. Yeah, I'm okay.
You're supposed to be giving us a ride somewhere?
You're supposed to be giving me a ride somewhere.
They got that mixed up somehow. Anybody in the ambulance, they're already having a bad day, so you gotta do your best to cheer them up, make them smile.
I had blood clots, DVT, and then I had 2 pulmonary embolisms. After that happened, I found out I had diabetes. Then after that, I found out I have cancer.
I think you're in need of a little higher level care, so I'm gonna go and I'm gonna talk to our dispatch, okay? And I'm gonna have them send some other people over here.
It feels like I'm kind of like in a jail. The last time I was weighed, I was about 550. And when I look in the mirror at myself, I don't like what I see. I really want to get that person back.
We're gonna have to come through the garage, so let's go ahead and get this couch moved back, and then we'll have to remove the door pins.
Often we find that we need to alter the patient's house so that we can get them in and out of there safely. I've not once walked into a room and been like, oh hey look, they're already in set. Now we're gonna roll you over this way, okay?
Just gotta be careful, guys, with her leg, please.
Yeah.
Leg?
Really
Yeah,
good.
Do you
right
really?
outside here.
Possible.
One, two, three.
We have our hover mat lets us slide them right over, and it causes them a little bit of pain, but nothing compared to what they would normally experience. 1, 2, 3. We actually have a strapping system that specifically goes onto their stomach so it doesn't roll off the side of the cot.
No, that was a good one.
Okay, here we go. Yay!
in trouble a little bit. Your sugar's pretty high.
You will run into the situation where you start taking their vitals and you realize they're really not doing too good. They might be on the verge of a stroke or a heart attack.
What we're gonna do is we're gonna give you some fluid. It should knock down your blood sugar, okay?
Instead of, taking them to where they need to be, you need to take them to the emergency room because there's something wrong.
It's always something for me, I'm telling you.
Without us, they'd be bed confined. They would never be able to get out of the house. That's what this bariatric rig is all about, taking care of these patients and getting them medical attention they need.
When I first started, in my mind, I'd say, man, how do you let yourself get that way? You're just lazy or something like that. But you realize they started this way not by choice, and they definitely don't want to be this way.
Let me call for a bed, a bigger bed, okay?
All right, Angela, it's nice to